Hi there. Welcome to Secret Obsession channel. Today we are going to be discussing the most important topic, in my opinion, every woman wants to be discussed. Before starting our topic, please subscribe to our channel. What are the most common causes of pain during and after sex? Sex is an activity that should always be enjoyable for both partners. Nevertheless, women often suffer from it. There can be several causes, from insufficient lubrication to health complications. If this problem affects you, don't worry, most of these problems are easy to solve. Pain after sex is more common than you might think. 1 in 3 women suffers from pain during or after sexual intercourse, says urogynecologist Michael Ingber for Health. What are the most common causes? Number 1 is urinary tract infections. 1 in 5 women will experience a urinary tract infection at least once in their lifetime. The most common symptom is a pain in the lower abdomen and urination. Inflammation caused by infection can cause cramps in the muscles surrounding the pelvic organs, Ingber explains. Penetration can then deepen and worsen these cramps. If you suspect a urinary tract infection, do not hesitate to go to your doctor. If the disease confirms, you will probably get antibiotics and the pain will soon go away. Number 2 is, too big cock can cause of painful sex. Size really matters. Too big a penis can be a far bigger curse than a small one. Anatomy plays an important role in sex pain, agrees Ingber. If your partner is well equipped, the muscles in the vagina and pelvic organs may suffer. The average female vagina measures almost 13 centimeters. If a man's nature is longer, then he can cause pelvic floor trauma to a woman, which can lead to cramps, he adds. If this is the case for you, experiment with positions. The ideal is, for example, the one in the style of interlocking spoons, or for hobbies, where the woman regulates the depth of penetration. Number 3 is, ovarian cyst. Most benign ovarian cysts on the ovaries are self-absorbed. Nevertheless, they can be a real nuisance, especially if you have regular sex. Ovarian cysts sometimes cause pain in the lower part of the pelvis where the ovaries are stored, especially when they are large, says gynecologist Keisha Gaither, adding that in this case, it is necessary to visit gynecology to assess whether the cyst can be absorbed spontaneously or surgery is needed. On number 4 is, too rough sex. Part of making love is experimenting with different types of positions. Sometimes, however, our acrobatic performances or too much experience are the cause of pain during or after sex, especially if there is a longer pressure on the vagina or vulva. Therefore, do not be ashamed to gently warn your partner that the given position is unpleasant for you, or immediately take the initiative and change the position yourself to the one that is pleasant for you. Number 6 is, insufficient lubrication. Insufficient lubrication is the most common cause of pain during sex. Sometimes we just let ourselves be carried away by the force of the moment, but our body is not yet sufficiently prepared and dry friction occurs. Other times there is no appetite or we are bothered by problems and our bodies do not get excited. What to do with it? Don't underestimate the magic of foreplay or be ashamed to include lubricating gel in your games. The truth is that the level of excitement is related, for example, to the cycle, pregnancy or menopause, when even the best foreplay may not help. Number 7 is, deep pelvic inflammation. Pelvic inflammatory disease is caused by a bacterial infection that enters the reproductive organs through the vagina. The most common culprits are chlamydia and bacteria that cause a condition known as gonorrhea. These can be transmitted during sexual intercourse from an infected sexual partner. This condition can cause pelvic pain and can even cause scarring or infertility. If you suspect that this problem affects you, do not hesitate to seek professional help. Inflammation must be treated immediately with antibiotics. Number 8 is, endometriosis. Endometriosis is a gynecological disease in which the endometrium, particles of the lining of the uterine cavity, grows outside the uterus. During the menstrual cycle, the endometrium, including endometriosis, is affected by female sex hormones. Cyclic hemorrhage and the development of chronic inflammation occur at the sites of endometriosis. Typical manifestations of endometriosis are small pelvic pain of varying intensity and sterility. At present, it is not possible to fully cure endometriosis. Thanks to various treatment methods, it is possible to alleviate pain, remove endometriotic foci, prevent the return of symptoms, and also maintain fertility. If you think the video is informational, please don't forget to subscribe our channel.